ASO partner also participate in that. And we have also invited our managed care organizations to be a part of that as well. County commissioners do participate from a couple different regions. There's not a minimum or a maximum number, so always welcome to have other new interested folks join those meetings for this next year. The quarterly meetings are scheduled currently for February, end of April, beginning of July, and November. It's a meeting that is co-chaired between the Medicaid Programs Division and the Division of Behavioral Health and Recovery here. And we have sort of a partnership with those county representatives and an ASO representative to help us with the agenda planning. I'll pause there to see if there's any questions or if there's more, if folks would like me to go into a little bit more detail about some of the stuff we've done in the last few years or anything of that nature. Happy to give more information.
Jessica, this is Justin with Spokane. Just wanted to add a little bit of clarification from our experience, and then you can clarify if you feel. But this really provides a wonderful opportunity for regional leaders, commissioners from counties to be able to have a direct voice in the ongoing behavioral health updates and feedback from the healthcare authority to be able to represent the counties directly. And we do our best to provide the information as part of the SCRILS, but this regular meeting provides it directly from the healthcare authority to regional leaders. So very unique opportunity to be able to, if you feel so led, to be able to engage in every opportunity possible to give feedback to HCA directly, but also to do so in any feedback where information is being provided directly to the communities to have that in a more regular and timely update, as SCRILS is currently a quarterly meeting. So appreciate that. Really encourage anyone, you can either go through us directly or to, we can provide you the HCA contacts to be able to join that, but highly recommend it. I know there's been a lot of changes in various leadership since that was first started for many of our counties. We can resend that out, but we highly encourage it if you would like to be a part of the discussion for healthcare and its impact on this, the state and your region directly.
Justin, this is David with New Alliance Behavioral Health. Can you send that contact information? Because of course we've got a commissioner turnover and I'd like to get that to the current commissioners. And then just a question, are there any of our regional commissioners currently participating in that group?
Jessica, I'll turn that one over to you, but I don't believe so.
Yeah, I was racking my brain too. I don't believe so at this point in time.
David, I think Commissioner McCart was originally slated for that, but I don't believe that there has been regular representation outside of the Spokane Regional BHASO. Again, we do our best to provide the updates on this as part of our regional updates as part of SCRILS, but this, I believe there has been some turnover since this was first started a couple years ago. Excellent.
Yeah, and I'll think I'll just put my email in the chat here if you would like to send anyone my way, or you want me to reach out to you, David, send an email to you for you to follow up. What's the best way of connecting here?
If you just want to pop your email in the chat, then you and I can coordinate. Got it. Thanks.
The other topic here, jail reentry and 1115 waiver services. We continue to try to move forward with some of the implementation of that authority approval. The first cohort for the reentry benefit package is currently scheduled to go live July 1. we're working, we had recently put out an RFP for a, gonna generalize it as sort of a clearinghouse, organization to help our carceral facilities, with how, the Medicaid billing and encountering, et cetera, that will go into, that will be part of the requirements here for this new service. So, that is currently open at this time. And that entity will also help with like coordination of trying to make sure that all of those elements that are required within that benefit package, that there's a provider in the area to provide that, make connections as needed, help support some of the training materials and what have you. So that is currently out and kind of waiting on that as we move forward here. The other work outside of that, I think is a little bit slower moving. You know, we had a quite an extensive list of potential things that were sort of approved conceptually, and we're still trying to identify which ones to prioritize, what time frame. When we work through those, we have to get into the more specific details with CMS on the programmatic elements. And so that is sort of where we are with that prioritizing and what have you. Any questions on that?
No questions on that, Jessica. I do appreciate the update, the quick update on the jail reentry work. I know Spokane County specifically is in cohort 1. There's been a lot of changes to cohort 1, meaning the original timelines were a little bit bumped out based on changes. So appreciate the healthcare authorities' work to give some allowances for us to be able to implement within a timeline necessary that meets certain guidelines that yet have been defined. So Spokane County is hard at work at that. I know there's other counties exploring this as part of their work. We encourage those counties to reach out to us if they have any questions, because we have an idea, work with healthcare authority on this. We've been very dedicated to ensuring that the initial investment dollars for that demonstration or that investment for reentry project ramp up is in place. But again, that's all in the reality of the $11.15 that we hope to have in place on July 1st and forward are in alignment with what our jail provider and our existing service network can maintain. So appreciate the work on that. Continue to be a part of those conversations. Any update on when that system goes live for the third-party billing is something that I know a lot of people are interested in. Now we heard November 1st, because that is the timeline for when that system that the state is putting in place. It's more programmatic, I know, but that's one of the key elements our system is waiting on for implementation. So we heard November 1st. We look forward to that. Really appreciate the ongoing communication on that.
I'm sorry. My brain isn't working quite too well today. So November 1st of 2025, or you're referring to a couple months?
Correct. November 2025 for the third party biller and the state setting up as part of the work.
Sorry, as of a few weeks ago, our hope was July 1 as everything being ready. I think we were really hoping to get the apparently successful bidder awarded, etc., and really up and running a couple months, if possible, before then, maybe May or so that folks had time to work out a few of the kinks beforehand. So that is the last I had heard. Things have really kind of gotten a little topsy-turvy in the last couple of weeks here, with the governor's directive, and so timelines and stuff are sort of just up in the air at the time for the time being.
Yeah, and we are, that timeline for the July 1st, for when that system goes, or at least where the ability to be able to bill for the system goes live, we're tracking. But the November 1st really is that third-party system that allows for the separate claims and billing processing from a third-party source. That's the go live, is what we last heard from the reentry group. Because that provider that the state will be looking to contract with, although will be established July 1st, may or may not be able to process claims by July 1st, which for those entities that need that or don't have it internally, that was where the November 1st timeline came into play. So I know we're looking at that. The hope is sooner, but I think the state didn't want to say much sooner until they had an idea. So I think that's where Spokane County at least is looking at.
And that probably tracks, as I said, I'm a couple weeks removed from looping back with that team too much. So if November is the new date, that probably is more realistic.
Any other questions or feedback from anyone? Not seeing or hearing any. I know the state's been pushing out a lot of meeting updates for those that are very interested in the reentry work. So if you are or have not or want to be a part of those, historically, please, there's a reentry work group email box. You can submit a request to be added into those meetings, and or we can make those available to you. So please let us know if you want to be a part of those conversations and hear about the work being done by the state. And I'll turn it back over to, I think, Teresa. The question on the opiate settlement funds was an update on really two things. What is the state planning to do, kind of in a high level view? I know that maybe you don't have all of the different programs in place, but also a question of if there were entities, counties and or municipalities that wanted to request additional funds to support ongoing projects, how would they do it? So two-part. What are you doing with it, and how can we be a part of it?
Yeah, good morning, Teresa Kleekamp, Deputy Director. I actually do not oversee this part of DBHR. So this is Chris Shera, Opioid Response Coordinator, and then the Deputy Director is Eno Spaja. So I unfortunately am not prepared for this topic and don't have my colleagues with me. So I apologize, I was not aware of the need or the agenda. And Chris is in another meeting, so he might be able to pop on in a few minutes here, but I'm teamsing him right now. I don't know if we want to see if we can invite him back for the next meeting. But my apologies, I'm not able to speak to this topic.
And we understand that, Teresa. A lot of things going on with the state right now. So if it's possible, we can move on to the next agenda topic. If he's able to join us, then we can jump back into that. But if not, then we'd definitely love to schedule that for the January period, if possible.
Okay.
All right, so we'll turn it over to Allison Paulson with our Better Health Together to give us the agenda topic on Community Care Hub update.
I have a few slides, so I don't know if I can share my screen possibly.
Do you have the share button accessible to you?
I do. I think because there's something being shared right now that I need that to be brought down. There we go.
Go ahead and give it a try.
Cool.
Uh-huh.
Perfect. Well, it is delightful to be back with you all. I see some friends' faces that I haven't seen in a while. So it is nice to see you, Dr. Nielsen, Commissioner Rosenkrantz, Kelly Miller. Oh my goodness. And Vicky, no face, but I see your name. So lots of heart emojis over here for some friends who have watched us evolve over the last 6 or 7 years. I'm here to do a quick update on what BHT is up to and our focus of the next Medicaid 1115 waiver. So I'll just, okay, hold on. Why is it? There we go. I'm gonna just start with grounding us in at Better Health Together. We are striving for health equity to support every individual in achieving their full health potential, while acknowledging their identity, opportunity, or environment and lived experience. I couldn't help myself because this group has been so fundamental to the first Medicaid waiver and BHT's work. So hard to believe that 5 years, that was really more like 7.5 years of Medicaid waiver is now complete. We've got a big check off mark that we have earned our $60 million as a region. We have done a ton of work to really support the integration of physical health and behavioral health, and increasingly trying to bring in all the other things that keep you healthy in terms of your housing and your food and transportation and childcare and so forth. We spent a lot of time in contract with a lot of partners, more than 100 folks contracted with us over the roughly 7-year period. And we continued to grow our competence in how we could support the community-based care coordination work, which is really our work of the work of the future for us. I'm going to just ground everyone in how we think about social determinants of health, and that while a Medicaid waiver obviously is very focused on the healthcare system, we will never achieve health outcomes for folks if we aren't also thinking about environment, health behaviors, and your access to services. For old time's sake, and only for old time's sake, I'm not going to go through every slide here, but this just showed how we earned dollars as a region. The integrated managed care funds were thanks to some bold leadership from our county commissioners to move into behavioral health integration, and earned us about $8 million for the region. All of those dollars were invested into our behavioral health providers. Then we had our project funds that we invested in providers, in regional infrastructure, in a community resilience fund, and then a little bit of administrative dollars for BHT. Before I get into my full presentation, I wanted to just do a quick grounding in our language. So we affectionately refer to waiver 1.0 as the waiver that ended in December of 22, and waiver 2.0 as the new waiver that started in July of 2023. Community-based care coordination, that is how we connect folks to the types of services that they need that don't happen inside a clinic. Health-related service needs. For those of you working on the re-entry project, I think we are all going to become very familiar with CMS's description of a health-related service need. In this next waiver, this is the designation for 10 specific services that CMS is allowing Medicaid to pilot during this waiver period. The Community Care Hub, this is the role that Better Health Together is going to play. I'm going to give you a lot more detail on that. Our social care network. So if you think about provider networks inside insurance companies, we are trying to build out a social care network of community partners that are delivering community-based care coordination. And then the secret sauce of all of this, I think we're gonna be able to all come to agree on, is the community-based workforce. You may be familiar with this terminology closer to community health worker, but this is really the inclusive descriptor that we're using, so that we make sure that we are including both community health workers, but also peers and doulas and other folks who are helping folks navigate through complex both healthcare and social care services. So it has been a big season of change for Better Health Together. I think once we made it through sort of this initial launch of Medicaid waiver 1.0, COVID hit us and shifted our focus into how can we really support the community responding to COVID. We did our best to connect folks to services during that period of time. And it really made it clear that while there is more work to be done, and I'm sure everyone on this call would agree with that, around how we're integrating primary care, physical health, and behavioral health together, those systems are starting to work together, and there really wasn't a role for the accountable communities of health to be involved in that. So we were delighted when the Healthcare Authority included in their Waiver 2.0 application this building out of a community care hub to really connect these various systems together. So we have been hard at work over the last couple of years, and I would say it's been very concerted through the COVID period and these last couple of years. But I don't think there's any Ferry County commissioners on, but our original Medicaid waiver project was a jail project up in Ferry County called Pathways, and we worked inside the jail to help connect folks to services. So we've actually been working on this community-based care coordination for several years. In highlighting how we've been thinking about this, we know, and this kind of goes back to my earlier slide about how important your ability to connect to non-healthcare services are in order to be healthy. And we see some real gaps in the ecosystem of that. So one, how we work with our community partners to ensure that folks who are from the community know how to support their community and access services. We know there are not enough services. We know with the budget deficits that the state is facing, that is going to be even more challenging. So we need to make it as easy as possible for folks to get connected. We love to talk about the fact that some folks have 3 or 4 care coordinators and some folks have none. There is not a good system that connects together care coordination that is happening at the managed care level, at the healthcare provider level, or in the community. Not to mention the fact that in order to get particular benefits that you qualify for, sometimes you have to go to this system and this system and this system overall. We are firmly misaligned on the financing of most of this work. The way dollars flow to communities is often through very specific siloed approaches to you can only use funds to do this. One of my favorite examples is HUD's funding of housing assistance that allows the housing assistant at a housing organization to coach somebody on how to get through their rental application and coach them on how to keep their space clean enough so they don't get evicted, but does not allow for that care coordinator to drive them to their behavioral health appointment to get their medication refilled so that they can sustain their behavioral health services. That's at the essence of what we are trying to figure out. How can we get those funds and those efforts better aligned? Finally, the last couple of things that I'll just say is on the social care side of things, or the social service side of it, there is very little systemic data to be able to look at how folks are getting connected to services and how that is relating to their health outcomes. So we've been pondering, what if we had an organized network connecting healthcare and social care? So in the Waiver 2.0 renewal, and I know you all have been briefed on this, there are 2 particular programs that, or 2 particular initiatives inside the waiver renewal that Better Health Together is working on. So one is these health-related service needs as they relate to care management and the support of the community care hub to help fund the workforce capacity and the capacity of those community-based organizations. A lot less money for our work in 2020 or in this next waiver, though I think probably the most concerted funding that we have seen available as we've watched these community care hubs pop up all over the country. I'm super, super proud of the fact that Washington will be the only state that has the entire state covered by community care hubs. So my 8 colleagues who are running their accountable communities of health are also running a community care hub in an aligned way that is similar to BHT's. And as I hope you all know, Better Health Together really likes to be the best at things or try to be the best at things. So we are really working towards being a high performing hub. At the essence of these community care hubs is the ability for community-based workers to connect with the communities that they are serving. And I think this is one of the sort of secret sauces that we see coming forward, and that the more we can help sustain funding inside community to make sure there are people who can help folks navigate these complex systems, it's going to be really powerful. And this will be sort of the scaling of a group of community-based organizations that are pretty deep in the community. So they're not sort of our usual suspects. I am going to leave you with, so that was a lot of blah, blah. And you're probably like, I don't really understand what you're even saying. So fortunate for everyone, the 9 accountable communities of health have come together and developed a sort of common way that we're talking about these community care hubs. So I'm going to leave you with our just released community care hub video to kind of help picture this for you. And then I'm happy to answer any questions.
Health is about more than what happens in a doctor's office. It's also about having a steady income, food, childcare, housing, mental health care, and social connections. Organizations across Washington work to help people meet their needs. Yet these groups are often disconnected from one another, making it hard for people who need support to navigate on their own. Washington's 9 regional accountable communities of health collaborate with community-based organizations and workers, providers, and tribal partners to better connect people to support services and connect support services to one another. Our question has been, how can we make a system that works for people rather than a system that makes people work? Community care hubs of Washington are the answer. They help people get what they need when they need it, transforming Washington's system of care coordination so people, families, and communities can thrive.
No.
Health is about more than what happens.
I won't make you watch it again. Commissioner, how can I answer your question?
First, it is great to hear from you, Allison. That was brilliant. One observation and then a question. The observation is that among the truest words that will be spoken this year and next year, or you're pointing out that the misalignment of resources that occurs because of the siloing of how services are provided. Solve that one, and you will both increase human or alleviate human suffering and go a long ways towards bridging the budget gaps that we face. So well done in articulating that issue really well. I applaud you. The question I have is your comments about the Republic County Pathways Program and the jail system hit home, because that's something that Pend Oreille County and I imagine other counties face. How can I better inform myself how that might transfer to Pend Oreille County? Because we need help with that.
Well, I will say the number one thing that I would recommend, and Justin will be your chief ally on this, is really paying attention to the Waiver 2.0 reentry program. I think big applause for Spokane County for enrolling in this because I think it is a really complex issue. I think the size of Spokane County is going to make it really challenging. I think there is a ton of opportunity in our rural counties because it's a little smaller system. Maybe it's a lot smaller system, I should say, and the ability to work on that. So I am happy to join with Justin in any way that we can be supportive on the re-entry work in that way. I think very specifically as it relates to Better Health Together, once you are ready, and I'm happy to come see you in January when I get back from a little vacation time, we can be a referral source from the jail and get them connected with a care coordinator. So while the Ferry County project had about 18-month lifespan, we're ready to get back together and think about that. And one of the things that we're really intent on in our social care network is making sure there's enough rural support so that we can connect someone to a care coordinator. And then we know we've got a lot of work to do on making sure resources are accessible. And part of that, making sure they're accessible, is that those care coordinators have access to real-time information about what is available in a region. So happy to come see you in January and we can talk some more.
I will coordinate between you and our clerk, Crystal Ziske, to get you on the calendar sometime first quarter 2025. Thanks.
Great. That sounds great. And Justin, I know, is tracking all of this reentry stuff really well. So that will be a equally important partnership. I think the way the state has structured that part of the waiver is has the potential to be truly transformational, both in starting to bend the amount of cost to jails and get Medicaid to pay its fair share of that, and the ability to really address folks' core healthcare and social care needs.
Yeah, I appreciate that, Allison. And Commissioner, definitely we can connect. I think there's a lot of work that can be done, not only on the reentry side, but upstream as we look towards courts and therapeutic courts and integration for engagement on that end. And I know that Pondere's been working very diligently on that side to look about coordinating. I think a lot can be done on the deflection side upstream. So that as we look towards reentry, that's more downstream when they're already incarcerated. So various ways that we have interaction with individuals as they evolve with the criminal legal system. Love to touch base with that a little bit further. As always, I have many thoughts, but may not align with what is feasible within your region. We'll be touching base, and we've been touching base with your guys' community services department as well as we look at 2025 and expanding out not only the recovery navigator program and engaging with upstream interventions, but also how does that integrate within your therapeutic court? Questions for Allison and Better Health Together? Excellent. Well, Allison, we really appreciate you coming and sharing. I know that the Waiver 2.0 has been a lot of work with BHT, and as we look forward, continue to have the support and engagement from a community perspective. So appreciate your time, and we look forward to 2025 and what we can achieve, especially as it relates to connecting and coordinating those services with health-related service needs. And I just want to note, we do have our chair of the board of county commissioners, Commissioner Mary Cooney, joining us as well. So although again, for substitute, I am going to continue to support her as co-chair, but she is now joining us in the room.
I just want to say thank you all. Sorry I was late. I was double booked this morning, so but happy to be back in the meeting. So, but I will let Justin, because you're now taking it's your section for the next part. So
Yes. before we jump into updates for a regional ASO, wanted to just touch base from Healthcare Authority. Do we have Chris joining us, or does it look like we might need to reschedule for January?
Yeah, I'm checking with them. I think it would be best for us to reschedule if that's okay. And I just sent an email to coordinate that with you. Sorry about that.
I appreciate that, Teresa.
Is that rescheduling for the March?
And it was my error, guys. I missed it. It was on an email and I missed it. So my apologies. I didn't see it.
No worries. So yeah, the next meeting will be March 14th.
And if we're able to, we'll try to coordinate a time in advance if there's something specific for an update on the opiate funds. Because I know that as we go into lead session, some of the things may be aligned specifically that the region would like to have information or give feedback, but we'll definitely be scheduling this for the March period.
Sounds good. Thank you.
All right, before we jump into the regional updates again, any other input either via chat or shared vocally in the meeting on anything we've discussed thus far? Questions? Hearing none, seeing none. Still not hearing any. We'll jump over to the ASO updates. I'll turn it over to Ashley to give us an update on our crisis response system as we look towards 2025. And then I'll give a quick update on the B and C topics.
Thank you. Hello, everyone. Ashley McGee, Integrated Behavioral Healthcare Manager for the Spokane County BHASO. And as we look to the January 2025 time period, just wanted to provide a brief update on some of our crisis response system and what we look to see in the new year. One of those updates is specific to mobile response and stabilization services. Previously, we were a part of a grant with SAMHSA to create that service for youth and families in the Spokane County to extend those services for the potential of up to 8 weeks after a crisis contact to assist in further collaboration and stabilization in the community. That will be continuing. That will be rolled under our Child, Youth, and Family Mobile Crisis Team in Spokane as they've been operating essentially as one unit. We will incorporate those as one unit, no longer operating under the SAMHSA grant, but within our crisis system of care. We are also in the beginning stages of onboarding and initiating our crisis response triage and mobile dispatch coordination unit, more commonly known as the mobile dispatch unit. And that, as Justin's previously spoken about in our previous SCRILS meetings, is really in response to that transition for the RCL and 988 and just better aligning our local resources due to our unique vertical integration with Frontier Behavioral Health being both of those providers, as well as aligning with the state on their future visions for that transition as well. Justin?
Yeah, no, that really highlights the work that Spokane County and our Spokane Regional Service Area has been doing, really looking at getting ahead of the game, investing the dollars smartly. We are going into a challenging season of budgets and being able to jump ahead and say, how can we better align and reconfigure our system to respond effectively with available resources is something we've been consistently looking at. And I think we're ahead of the curve on this one for our region. For our rural counties, for Ferry, Lincoln, Stevens, and Pend Oreille, Adams counties, those services for our regional crisis line in conjunction with the 988 should not change. So the referrals, the coordination with your teams and with the counties, either first responders or other necessary coordination efforts will remain the same and or will allow for enhanced communication. We are still in the process of how that looks, but the dispatch from 988 to our MDU will still go through your crisis response teams. Again, the goal here was not to have separate and disparate systems, have it all under a single vertical dispatch unit, and then have those existing lines that we have in connection with the crisis response systems in your counties be the expert on the ground dispatching out your response teams. So dispatch as a whole will still occur as it happens through the existing lines, but the requisite and responsive crisis response agencies in each county will still designate their teams on the ground. So really trying to enhance that, not see any actual changes to how individuals receive services, but better utilize resources given to us in response to a changing and always changing, but evolving system. So stay tuned. Again, shouldn't see any major issue there. Since we're already on the topic, Kelly, anything you would like to add from Frontier's perspective as we work on this very exciting, but potentially, challenging implementation period for 2025?
No, I think you and Ashley both described it perfectly, especially with the previous SCRILS meeting. I think the biggest thing is just for our providers to know that there will be no disruption in the experience between exchanging information or coordinating between staff. If anything, there's a real intention to make referrals to crisis services in Spokane or coordination through Spokane more efficient. So I'm really looking forward to opportunities to do that after the first of the year.
Thank you, Kelly. And just a little bit more on that in terms of developing a overall regional dispatch protocols and plan. We are in the works of that as the ASO in conjunction with Senate Bill 6251 and the state. And so we will intend to have a plan incorporating all of these different components as they're being developed and being put in place by the July timeframe and released for public consumption as well.
Excellent. Any questions? Hearing and seeing none, we'll give a quick update on our work for the Crisis Relief and Sobering Center, then kind of what we're doing with the opioid dollars, which is all in alignment with the Crisis Relief and Sobering Center. So what we've identified, as we've discussed previously, is a major gap in our region for individuals being able to walk in or receive immediate care. Currently, as it exists, we have limited facilities that allow for individuals to be admitted directly from the street or to have walk-in. Either they have to meet medical necessity criteria or they need to be cleared. So one of the ways that Spokane County is trying to get ahead of the game is align with the state system for new and designated facilities that meet that need. So Crisis Relief Center, but also provide for the unique needs specific to our region. So we've added a sobering center component to a crisis relief center, hence the name Crisis Relief and Sobering, will allow us to provide 24/7 response to the community, drop-offs regardless of the behavioral health symptomology the individual is experiencing. Again, excluding those specific areas where involuntary treatment and or medical clearance is needed. If they're in active, renal failure, we're not going to be able to accept them in that facility. So there'll be some conditions, but for the majority of them, medical necessity criteria will not apply. So they'll be able to be admitted, at least for 23-hour and 59-minute, and then also utilize our sobering center for those experiencing the symptomology associated with substance use. So that is something we're building out. Spokane County's looking at a projected 2027 completion of the project. If everything goes well and there's no hiccups along the way, we're currently in the design, build, selection process. We'll be working at bringing on a provider here in the next year. So hard at work at that. Commissioners for Spokane County have aligned both our opiate dollars, at least $5 million of that set aside for this project. They also have mental health sales tax, which is our 0.1% of 1% sales tax for this project, set aside as well as part of our reserve. And we're also looking at federal and state joint partnership. So more to come on those two areas as we receive more information from the state and federal partners. But we want this to be a regional response to the need that exists, not only now as the need we are seeing currently on the street and the impact of fentanyl crisis, but also 2 years from now, so that we are responding to whatever new comes. that we aren't able to see coming down the pipe. So that is hard on the heels of the additional work that we're doing in the community already by opening up an expanded sobering and triage bed capacity through our provider stars that has already gone live. And they've already indicated that they're going to be hitting their capacity just by taking on the existing need. And we're looking at other ways we can expand that. So we're rapidly deploying those services now and then looking in the future. And then we have other projects that we're working on as part of the opiate investment. Now, this is part of what the board has already approved in Spokane County for $7.5 million of investments. Now we're looking at next stage. So that was phase one of opiate investments, 2 of which are already there. Well, 3 of which is already there, including our investment in long-term housing for support for women, children, and those impacted by neonatal abstinence syndrome. That will build out housing and transitional housing support through Maddie's Place. And also the work with the Sheriff's Department to begin building up and being more responsive to the data collected from law enforcement and regional partners on opiate use and other substance use impact in the community. So along all of that, we're starting to look forward to phase 2. What is the next need that exists in the community? And that is something that community services and the board are having initial conversations. How can we partner with other regional municipalities to address that immediate need? Some of that has come forward, but has not yet been determined. It has been discussed historically as well, is immediate medication-assisted treatment for MOUD, medication for opiate use disorder, as well as immediate treatment for OTP, opiate treatment programming. That is something that we'd like to expand out to look at 24/7 response, or at least walk-in response. Another area is expanded bed capacity for areas that meet the need that we've been identifying with our regional partners, not only for those that are impacted with opiate use disorder, but other substance use and homeless-related issues. So various areas that we're looking to explore. Again, really looking at gaps and how can we maximize funding while maintaining sustainability. Key areas that we're looking at, especially in 2025. So more to come on that as we look towards that area. For those that are not already a part of it, Spokane County also runs our Opiate Abatement Council, which gives regular updates on these items and with our municipal partners throughout our region. So please reach out to us or look at our website for those that like to listen or look at the data that has already been presented. We do anticipate updates to that in the January period as we bring those forward and new priorities are aligned and voted on by the board. So more to come on that. It's exciting work, but at the same time, it is challenging work as we look towards budgets. Ensuring that whatever we start is sustainable and that individuals don't have time-limited engagement, but long-term service to benefit the needs that exist. So I'll pause there because that was a lot of information. Open it up to both our online or in the room if there's any feedback or comments.
I did put the link to the OAC webpage in the chat as well.
I can't promise it'll be riveting, but I certainly will promise that it is informational. So, sorry, no graphics, but certainly there is information. All right, hearing and seeing no feedback or comment, expressions of joy or, feelings of elation. We'll move on to topic number 5, which is our charter renewal update. So most of you have already been aware that we are at the end of our designated SCRILS charter timeline for the year. Now, when the board approved this last year, it was at the end of a statutory creation of the SCRILS, which the Board of County Commissioners and all of our commissioners from our other counties, Ferry, Lincoln, Stevens, Pondere, and Adams, agreed to continue in partnership with both our community members, the state, and other stakeholders. As part of that, there was a time-limited charter renewal which was again, December 31st, 2024. Discuss this as part of our feedback from the group is that this is beneficial. It helps. We'd like to continue this going. The Board of County Commissioners, Spokane County, also are very supportive of continuing this going. So most of the commissioners from our rural counties should have received an update to the charter, not just to renew it for another year, but to extend it out for 5 years, recognizing that as this has been working, it's been beneficial, that the charter aligns our existing work for the next 5 years, but does not mandate or require that anyone from those municipalities adhere to any of the attendance of that, just that they are willing to participate and be a part of that. Again, if you are agreeing to that, and the commissioners have, that there are certain expectations for it, but at least moving forward, we will continue with our goal to achieve communication, coordination, engagement across our 6-county region, and also provide an opportunity for our 6-county region to give feedback and answer questions, concerns, and or to be able to share information on impact for our region. This is imperative as we look towards re-procurement, as we've discussed in the next couple of years, but also to ensure that we continue to have collaboration across our counties. So for the counties that have already submitted those back, thank you. For those that haven't, we look forward to receiving those. And for our partners here, this is just a commitment from our commissioners and the commissioners across our region. We intend to move forward with this partnership for the next 5 years. And there is no major change to the charter except for the timeline. Moving the re-renewal for an annual basis, moving to 5 years, extending this out beginning in 2025. So we have the same conversation in 2020, well, really 2025. No, 2030, sorry, man, I'm way behind. 2030, but really in 2029 as we look for that. And that's future Justin's problem to deal with. But for now, should not see any issues in impact. So wanted to have this opportunity as we look towards the new year to have any further conversation or just continued affirmation to move forward with this process. And I see a hand here, Commissioner Rosencrantz.
I'd like to just say that SCRILS has proved to be one of the best returns on investment in terms of time for me as a commissioner. It condenses a lot of work that a lot of people do around a lot of issues that I only have a fairly topical understanding of. So I am applauding you wildly right now, even though you can't see me.
Well, I can certainly envision you sitting there dancing around or clapping your hands. It all goes to our board and really our chair, Commissioner Cooney, who's really been advocating for this. So to all of the electeds who support this work, thank you so much. We're able to give back as much as we're able to. But again, I feel that the benefit that our region receives truly is the benefit, not only to the taxpayers paying into the system, but also to our stakeholders and community who get to have a voice. So appreciate that, Commissioner.
Yeah, and I'll just say thank you, Commissioner. I agree. I mean, I think this is the one forum that we get to have everybody kind of come together and learn and see what's happening. So we know kind of how to move forward and where the issues are and where we need to do better, but where we're already doing really good things. So I find it very beneficial myself as well and look forward to extending it for another 5 years.
Okay. Any other questions, thoughts, feelings of joy? Hearing none, seeing none in the chat. I'll give one last call for any final thoughts on the charter renewal. Excellent. Well, look forward to another 5 years of this work. For those that will still be with us. I definitely look forward to the work and what we can do and accomplish in the next couple of years. Now, this enters into our public comment and open period for community stakeholders or any other topic we didn't cover. So we'll open this up for public comment and or agenda topics we didn't cover. First call for any input. second call for any input or comment. Third and final call. Hearing
Excuse me,
none.
this is,
Oh, I'm
this
sorry.
is,
Go ahead, please.
that's okay. This is Commissioner Mark Burrows from Stevens County. I am a call-in user, so I couldn't put my name into the chat for attendance, and I just wanted to echo Commissioner Rosenkrantz' comments from earlier. Looking forward to another 5 years.
Excellent. Appreciate that, Commissioner. Very much appreciate the support from Monterey and Stevens County, as well as Ferry, Adams, and Lincoln. All right. Well, I appreciate everyone's time on a Friday the 13th morning. For those that are superstitious, I apologize. But for those that are not, well, have a wonderful day. Stay safe in the snow. And if we don't see you before the new year, have an absolutely wonderful Christmas and safe travels. Thank you and have a wonderful day.
Thanks,
everyone.
Justin.
Merry Christmas.